Hi guys, let's show you how to open a suture material. So this is how the packing comes, whether it is absorbable suture or a non-absorbable suture. Every kind of sterile packings comes with a flap here. So there is a small flap over here. Okay, you can see it comes in blades also. It comes in all the surgical packings, not in the syringes, but mostly all the surgical packings which are uh, sterilized. It comes in a packing like this. There is a flap here, and this end is sealed, and this end is there is a flap here. You will identify the flap area, rather you will teach your assistant to do it. Then the assistant, what will he will do, will tear open this and keep keep his hands like this only. He will not touch the suture material. Now with your own sterile hands, you will take out the suture material. This paper is also sterile, you don't have to worry about it. Now can you see a small cut line over here? This small cut line is here. You are going to break it. Here it is written tear, so I'm going to tear it. Here I can see my needle. So what I will do now is, I will take out my needle holder. I will grab this, not from the eye, not from the tip, from 1/3 of the distance from the eye. I'm going to take it and I'm going to remove, and I'm going to release the thread from here in a single go. Right. So this is how the suture is removed from its packing.